back to me. The Anxiety and Depression Association of America, or the ADAA, says that anxiety disorders affect 1 in 8 children between the ages of 12 and 18, and it is now increasing due to the negative effects of social media. The types of anxiety that teenagers typically experience are panic disorder, social anxiety, and the most common would be general anxiety. The types of depression are major depression, persistent depressive disorder, bipolar, psychotic, situational, and atypical are just a few. Anxiety and depression typically come hand in hand, but can also be involved with eating disorders and attention deficit or hyperactivity disorders. These affect more people than most of today's society realizes and is often worsened through the negative effects of the media. The National Institute of Mental Health states that anxiety is a normal part of childhood and an emotion that everyone will experience at one time or another. Although every child will most likely go through some stage like this, it is temporary and harmless. Most students will feel anxious when faced with problems, before taking a test, or when they know that they have an important decision to make. This is not anxiety. Normal things like this that some mistake for anxiety really just keep us alert or to danger in a situation that could cause nervousness. Once fear, nervousness, shyness, and avoiding places or certain sites become consistent or overwhelming in the person's life is when they could be diagnosed with a disorder. Although it is okay to feel down once in a while, it is not okay to post about it to get negative feedback. Different types of depression that comes along with anxiety could be treated with medicine, therapy, and changes to your lifestyle. This advice, coming from the Depression Health Center, says that more people should be aware of their feelings and the acts of those around them. Be conscious to what you see on media and your friends' posts. Some depressions are caused by the fear and uneasy feeling that anxiety brings. Others are from events in your life, or in more severe cases, chemical changes in your brain. Professionals are now saying that there have been more cases of anxiety within the last 8 years, relating this back to the onset of negative comments towards the individual on their social media sites. Examples of these negative comments could be degrading them on a picture that they would post to a site such as Instagram, replying back to an opinionated post with threatening comments, and could go to the extent of being told to end their life. The textbook of Communications, Making Connections states that your state of mind can influence your life in general. When you have a negative mindset, you'll have negative thoughts and therefore negative posts. With this, the style of treatment could vary depending on the intensity and type of depression that you could be experiencing. According to the ADAA, symptoms can range anywhere from the person having suicidal thoughts and actions to simply having problems sleeping. As said before, these two typically go hand in hand, so their symptoms tend to be quite similar. They could range from feeling panic, fear, uneasiness, shortness of breath, inability to be still or calm, muscle tension, dizziness, and negative posts. The exact cause of either of these disorders continues to be unknown, but is definitely not the result of a personal weakness, a character flaw, or poor upbringing. Although, again, the ADAA has said that within the past 8 years, social media has been seen more in these types of cases in a negative concept. Sadly, suicide is a very common ending result when we talk about these two disorders. Even more unfortunately, it is too becoming more common. According to the American Journal of Public Health, in 1990, from ages 15 to 19, about 27% of girls were committing suicide. And in 2006, from ages 15 to 19, about 36% of girls were committing suicide. Social media shows signs such as qualified depressing posts, some even posting a final goodbye to their media page. Commonly used medicines to these disorders are a class of drugs labeled benzodiazepines. The use of these drugs has declined because of their addictiveness, even though their only known side effects are drowsiness and possible dependency, is what Medical News Today has said. The most common of these are Ativan. Others are antidepressants, which are used for depression or anxiety. Through these, some counselors look at the patient's social media sites to see clues. In today's media, anxiety and depression are more often joked about than actually talked about. And the University of Michigan study in 2012 said that 57% of social media users said they felt uncomfortable or worried when they weren't using the media, and when they were, 51% said that it changed their behavior negatively. 68% of users said that they have trouble sleeping or relaxing after seeing what is considered normal interactions on the media because they're negative. Although the ADAA and Medical News Today said that mild anxiety and depression feelings are normal and typically a part of childhood, it has been proven that there are specific things everyone can do to reduce their risk, and if it so happens to get diagnosed, there are plenty of different options and medications. Symptoms vary from person to person, so the National Institute of Mental Health suggests to be upfront, and especially in today's society, to take note on your friends' posts or pictures. Throughout the years, the number of people diagnosed with anxiety and the number of suicides due to depression have gone up. The ADAA says to be alert to obvious symptoms and never take things too lightly. That way, this number can start to decrease again.